used to have patterned silk pants. Are we live?
You're live now.
Oh, now we are?
Yeah.
Okay. We were just talking fashion, everybody. Okay, so we have our patient here. Happy Monday. We are doing a little bit of lips, so it's a great way to start the week. So our patient has had filler over the last 8 or so years, just a couple times. And we were just talking about how when you maintain your treatments, they're going to last even longer. It's like you're building upon it and they're not wearing away as quickly. Everybody's different, every filler is different, so how long it lasts and for each individual and in different areas, it's going to vary. So we're gonna be working on her lips. She's got a really nice pouty lower lip, and for her, she likes a look where the bottom lip is a little bit bigger. So we are gonna add some size to this top lip as well as the bottom, and just be very even in our distribution. You can have all different types of lips, different shapes and styles. Some people like a keyhole pout, others like a little bit more of a little pick-me-up in the vermilion border and over here by the fill trim. So depends on what you want and what look you're going for that you can customize, but when you're starting with nice lips like our patient is, they're gonna look awesome.
Oh,
So we're just gonna go for a little bit of volume all around. And then we had topical numbing. So lips always feel a little funny, a little pinch in the middle. Great job. So what I use lately is a lot of this pillar technique. And the reason I like it is because I'm able to lift the lip height as I'm injecting. And different lips, whether they're thin or if you're injecting lips that are a little bit longer, you're going to use different techniques. Some techniques will elongate the lip a little bit. Some are going to elevate the lip a little bit, and it depends what the patient's looking for and what you're looking to correct as far as anatomy goes. So you can already see just that one side has a nice little plump. I love it.
What lip filler are you using?
We're using Ultra Plus, and so because her filler lasts so long, we don't need to choose necessarily one of the longer lasting. If she told me, that she burned through her filler, I would opt for something that's going to last a little bit longer. But for her, she does well with something that has an indication for 8 or 10 months and she's getting years out of it, then we're happy with that. All right, guys, I'm just gonna pop my cut here. Perfect, close. Good. So we're just doing Ultra Plus, and the reason I like Ultra Plus for her is because it's going to be really soft, really kissable, and it's gonna have that pillowy kind of look to it. So we're just about halfway through our syringe, and we'll show you what that looks like. A lot of times people are concerned at how much one syringe is or half a syringe and how much they're going to need. It just depends on what the starting point is and what the goal is. Close. Good, and relax your mouth. Perfect. Any questions?
Have you ever used Revenus Versa?
Yeah, we use Versa all the time. So Versa is actually great in the lips. It's very soft, so patients love it. It's not going to last quite as long as something like Lift or Voluma, and you can be using all of these products in different areas of the face. So I'm very comfortable using Voluma in the lips or using Define in the lips. So it depends on, gosh, those are pretty. It just depends on what the patient's looking for, longevity. Versa is a great starting filler, I think, for lips because it is so soft. It is a good starting filler, very soft. And you get a lot of your one vial, so that's nice. Or your one syringe.
Not bad.
Not too bad, you're doing great.
Thank you. You get a little flinch, but it's tolerable.
We'll ice it after. Lips are very, very sensitive, and so this product is definitely going to swell. You know, it's good to plan doing these kind of treatments around your social schedule if you are worried about swelling. If you're worried about swelling, then definitely want to do this when you'll have time to sort of hide out for a little bit because it is going to draw water to itself. That's called hydrophilic. And you're gonna have that swelling for about 3 days, I tell people. So try to plan accordingly. Looks great. I'm gonna switch sides.
What's your favorite filler to use in the nose?
In the nose? So truthfully, I don't do a lot of noses. I think all patients should be aware that the nose is an area that's a little bit more dangerous because of its vasculature. So you definitely want to be seeing someone who's doing it frequently, very well versed in their anatomy, and has been doing it for a while. That being said, products that are best for the nose are going to be products that don't swell. So anything that is hydrophobic or resists attracting water is going to be best in the nose. Relax. Last little bit here, but they look so pretty. And we just went for some very proportionate plumping kind of all around. Great. So my last little bit here is smoothing out the filler. Go ahead and open. A little lip massage, funny feeling. They say that this can contribute to swelling, of course, because it's manipulation, but I think it's nice to be able to blend out the product. Something up top. Okay, guys, and the reveal. Perfect. They look great.
For sure, I think I'm more swollen on the top, and then this will be.
Yep, definitely more swollen up top, especially where we started. This product definitely draws water and swells pretty quickly. That being said, we'll start icing.
You're amazing.
And we'll ice for the rest of the day. 20 minutes on, 20 minutes off. We'll keep that swelling down.
Thank you.
All right, guys, that was a little bit of lip filler to start your Monday. Thanks for watching.
Woo.